Right now, at this very moment, your feet may be sending you a message that could save your life. And there is a very good chance you have been ignoring it completely. Most people believe that diabetes is something a blood test tells you about. You walk into your doctor's office, the lab results come in, and only then do you find out. But that is not the full picture. Your body starts sending warning signals long before any medical test ever would. And the very first place those signals show up? Your feet. In today's video, we are going to walk through 9 specific warning signs that appear on the feet of people with undetected high blood sugar. Sign number 1 is something almost everyone writes off as completely harmless. Sign number 4 is hiding in plain sight, and most people walk right past it every single day. And sign number 9 is one that almost no one has ever heard of. Not from a doctor, not from a health brochure, not from anywhere. By the end of this video, you will know exactly what to look for, what each sign means inside your body, and one simple daily habit that can protect you starting today. But before we get into all of that, my name is Dr. Vanse, and I have spent years working with patients whose lives changed the moment someone finally told them what to look for. That is exactly why I created this channel. If this is your first time here, welcome. Please hit the subscribe button right now and click the bell icon so you never miss a new video. I put out new health content every week, topics that truly matter, especially for people over 60. Let's get into it. Here is something that should concern every one of us. The American Diabetes Association has reported that roughly 1 in 5 people living with diabetes have no idea they have it. That is more than 8 million individuals right now walking around with a condition that is silently affecting their nerves, their kidneys, their eyes, and their feet. The good news is that a simple blood glucose test, often available for around $12, can detect this early. But before you even get to that test, your feet may already be giving you the information you need. Let me share something with you. I once sat with a patient, a 67-year-old retired man who felt fine and came in simply for a routine checkup. Before we ran any lab work, I asked him about his feet. He mentioned that they had felt a little numb for a while. He assumed it was just part of getting older. By the time we reviewed his results, his fasting blood sugar came back at 214. He had been diabetic for over 2 years and had no idea. 4 of the 9 signs I am about to show you were already visible on his feet. So let us go through each one. Sign number 1, tingling, numbness, or that pins and needles sensation in the feet. Nearly every patient I have seen with this has explained it away. They say their foot just falls asleep sometimes, usually from sitting a certain way. And yes, that happens to everyone occasionally. The key question is whether it is happening regularly without any clear reason. When blood sugar stays elevated over time, it begins to damage the protective outer layer of the nerves. Think of your nerves like electrical cables. Each one has a coating that keeps signals traveling cleanly. High blood sugar acts like a slow acid eating through that coating. The signals start getting disrupted, and that disruption is what you feel as tingling or numbness. This condition, known as peripheral neuropathy, is one of the earliest and most common complications of elevated blood sugar, and it almost always begins in the feet. My recommendation here is a 20 to 30-minute walk every day. Not running, just walking. It keeps blood moving into the feet and helps protect those nerve endings. And start cutting added sugar from your diet now, not next month. Sign number 2, a burning sensation in the soles of the feet, particularly at night. Many patients tell me they figured it was from being on their feet all day. But burning foot pain that strikes at night, when you are lying still with nothing to distract you, is something I take very seriously. What is happening is this. The nerves have been damaged by excess glucose and are now sending incorrect signals to the brain. Your brain receives a message that something hot is touching your foot, but nothing is. The nerves are misfiring. Research published in a leading diabetes journal found that this type of burning foot pain often appears 1 to 3 years before a formal diagnosis is made. 2 habits I recommend. Drink at least 8 glasses of water daily to help your kidneys manage excess glucose, and add more fiber to every meal through vegetables, legumes, and oats to slow how quickly sugar enters your bloodstream. Sign number 3. And this is where things shift from uncomfortable to genuinely dangerous. A wound on your foot that simply refuses to heal. Patients come in and say they had a small blister from their shoe 3 weeks ago, and it is still open. They waited because they assumed it would close on its own. When blood sugar is consistently high, the tiny blood vessels throughout the body begin to narrow and stiffen. Oxygen, nutrients, and the white blood cells your body uses to heal simply cannot reach the wound in time. Picture a garden hose with a severe kink in it. The water is there, but it cannot get where it needs to go. That is exactly what elevated blood sugar does to circulation in the feet. And an open wound that refuses to close becomes an entry point for infection. After your next bath or shower, sit down and examine both feet carefully. Look between every toe. Look at your heels. If you find any cut, blister, or broken skin that has not improved in 48 hours, contact your doctor right away. Sign number 4. Skin discoloration around the ankles. Patients often tell me they have always had darker skin around that area or assume it is sun damage. But there is a specific pattern of darkening, deep red, reddish-brown, or a bluish tint, that tells me blood flow to that region is being restricted. When circulation is compromised, the skin at the lowest points of the body begins to change. It may also become thinner and more fragile in those areas. A study found that these skin changes can become visible on average 18 months before a formal diabetes diagnosis. My suggestion here is 5 minutes of ankle circles, toe raises, and gentle calf stretches every morning. Even that small amount of movement makes a real difference in getting blood flowing into the feet. Sign number 5. Severely cracked heels that do not respond to any moisturizer. Nearly every patient tells me this is just dry skin, especially in winter. And sometimes it is. But when your heels are cracking deeply in the middle of summer, or when no amount of lotion provides lasting relief, that points to something different. Diabetes can damage the nerves that control automatic functions in the body, including the sweat glands in the feet. When those nerves stop working properly, the feet lose their natural moisture from the inside. No lotion can fix that root cause. Those cracks also become open doorways for infection, and in a foot with poor circulation, that infection can turn serious very quickly. Moisturize your feet every night before bed, applying lotion thoroughly to the soles and heels but never between the toes, as trapped moisture there creates conditions for fungal infections. Sign number 6. Persistent swelling in the feet and ankles. Not the occasional puffiness after a long day on your feet. I am talking about consistent swelling and deep sock marks every single evening. High blood sugar affects kidney function over time, and the kidneys are responsible for controlling how much fluid stays in the body. When that filtration system is under stress, excess fluid gravitates to the lowest point, the feet and ankles. If you press your finger into the swollen area and the indentation remains for a few seconds, that is a sign worth discussing with your doctor. When resting, elevate your feet above the level of your heart. Even a couple of inches on a pillow helps pull that fluid back toward the core. Reducing sodium in your diet also makes a meaningful difference, as salt encourages your body to retain water. Sign number 7. Sharp, stabbing, or electric shock pain in the feet, especially at night. The majority of my male patients in particular have been taking over-the-counter pain relievers for months, convinced it is arthritis or an old injury, and sometimes it is. But when nerves are damaged by chronic high blood sugar, they can become overactive. Instead of going quiet, they start firing random and intense signals. The pain is completely real, but it is coming from damaged nerves, not from an injured joint. Taking a pain reliever does not repair a nerve. It only silences the signal your body is trying to send you. 5 minutes of gentle foot and ankle stretching before you get out of bed each morning can help. Flex your feet, roll your ankles, pull your toes back slowly. And a gentle 3-minute massage along the sole and up toward the ankle before bed can also help stimulate circulation in those nerves. Sign number 8. Feet that stay cold regardless of the temperature around you. Cold even in summer. Cold under multiple blankets. Cold even when the rest of your body feels warm. This is a strong indicator that blood circulation to the lower extremities is significantly reduced. The blood vessels have narrowed to the point where warm blood simply is not reaching the feet in adequate volume. Think of it like a heating system where the pipes to the far end of the house have been pinched. The furnace is working, but the heat never arrives. The American Heart Association identifies peripheral artery disease, largely driven by diabetes, as affecting over 8 million Americans. And persistent cold feet are among its earliest and most consistent symptoms. The best response is a 30-minute brisk walk every day. Start with 10 minutes if that feels like too much. What matters most is that you begin. Sign number 9. And this is the one almost no one ever talks about. During a foot exam, I look at the lower legs and the tops of the feet. In some patients, there is a noticeable absence of hair in those areas. The patient looks down and says they never noticed that. And that is exactly the problem. It is a quiet, easy-to-miss sign. Hair follicles need a steady supply of blood and oxygen to function. When circulation has been impaired for a long period of time, the follicles in the feet and lower legs gradually stop receiving what they need and eventually stop producing hair entirely. That visible absence of hair growth is a marker of blood vessel damage that has often been building for years. Right after this video, look at your lower legs and the tops of your feet. If the hair appears significantly thinner than the rest of your leg, or is absent altogether, schedule a blood glucose test this week. Not this month, this week. We have just covered 9 signs, 9 opportunities to catch something before it has a chance to cause serious harm. One of the most difficult parts of my work is sitting across from someone who has had every one of these signs for 2 or more years and is only just now finding out what they mean. Not because they did not care, they cared deeply. They simply did not have the information. You now have that information. Tonight, before you go to sleep, take 30 seconds and look at your feet. Check the skin. Feel for numbness. Look for any wound that should not be there. And if you notice anything on this list, please reach out to your doctor. The earlier you catch elevated blood sugar, the more completely it can be managed, in many cases through changes in diet, daily movement, and an honest conversation with your healthcare provider. You have worked hard to build the life you have. Do not let something as manageable as blood sugar quietly take any part of it away simply because no one told you what to watch for. Now, you know. If this video helped you, I want to hear from you directly. Drop the word yes in the comments if any of these signs felt familiar to you. And share your suggestions in the comments. What topic would you like me to cover in the next video? I read every single comment on this channel, and your ideas genuinely shape what we do here. If you found this content valuable, please share it right now with someone you care about, a parent, a sibling, a close friend. You might be giving them something they did not know they needed. And if you want to keep receiving content like this, honest, practical health conversations that go beyond what most people ever hear, make sure you are subscribed to this channel and have the bell icon turned on so you never miss a new upload. This is exactly the kind of content I put out every single week, and I would love to have you here for all of it. I am Dr. Vanse. Stay informed, stay proactive, and please take care of those feet. I will see you in the next one.